Hi, I'm Dan Kenner, and this is the Dr. Dan Kenner Show. This is going to be a really interesting show today, so I hope you'll all stick with us. We're going to be talking to Dr. James Butler, who's a graduate of the University of Kentucky Dental School with a residency in advanced dental care. He's been in practice for 30 years, and he's going to tell us about bioesthetic whole mouth dentistry. Dr. Butler.
Thanks, Dr.
Good to have you here. Can I call you Jim?
Yes, please,
well,
Dan.
Please call me Dan.
Thank you.
Great. So let's find out, what is bioesthetic dentistry? How would you define that for our audience?
Well, bioesthetic dentistry is the practice of dentistry recognizing what factors keep natural teeth healthy and happy. We study people who have never had dental problems, the size, shape, position of the teeth, the relation of the jaw joints to the teeth, the health of the gums, and the factors that affect that. And what we try to do is take people who don't have that and see what we can do to help them move toward a bioesthetic result, which would be more stable and more naturally beautiful.
Mm-hmm. It sounds like it's been research into wellness dentistry instead of just studying dental diseases. What would you say are the most important issues today in dentistry?
Yeah, well, you're correct. It's a whole mouth approach to dentistry, and the only way to have a stable system is to look at all the factors involved, because there's so many factors affecting us now. The biggest things that are happening, and my practice focuses on people generally 50 to 80, generally have maintained some natural teeth, have had a lot of traditional dentistry, crowns, fillings, root canals, things we've all experienced at this age group. And what we're doing is finding ways to help them, their teeth last long enough. So we identify why the teeth are aging faster than the person, because with the breakthroughs in medicine and health, people are living longer. So what we're running into is people simply wearing their teeth out and their dental work out before they wear out. That's one of the biggest ones. So the major factors is the wearing out of all the mechanized dentistry of the 80s and 90s. We thought we had it down pretty good. We thought things would last. We did all this dentistry and we find out that we're outliving it. Okay?
Well, it sounds like that the past methods of dental care have been sort of piecemeal, just sort of patching things up and replacing one thing at a time, instead of really looking at the whole mouth.
Well, that's true. I mean, when I got out of dental school in 1982, I was a pretty darn good tooth dentist, but I didn't realize how much of a mouth dentist I wasn't. And it took 20 years or so of continual study to realize that these people are living longer, and taking a tooth approach to it is probably not going to go far enough.
I like that, a tooth dentist versus a mouth dentist. That's you're taking a whole systems approach to the mouth then. So what kinds of health issues can people face other than just the dental problems when there are problems with the teeth?
Well, the oral health is a reflection of the general health. And what we're finding is that not only can we see in the mouth early changes of systemic diseases, gum disease can be an indicator of blood disorders, diabetes, of other problems, and other issues that we have. Advanced decay can be a sign that the body's too acidic. There's early warning signs in the mouth, a lot of times before the body can feel the events that will lead to poor health later. So it's important for us to study what a healthy mouth looks like, and when it's not healthy, some of the underlying causes can be general health issues that need to be addressed before we're going to get a stable result with restoring the mouth.
Well, this is getting more interesting all the time. We've gone from one tooth dentistry to whole mouth dentistry. Now we're talking about dentistry of the whole body. Well, now a lot of people are also taking prescription drugs too. What kind of effect, even though they're for maybe a systemic reason like blood pressure or blood sugar control, what kind of effects can they have on the mouth and the dental health?
All medicines have side effects. This we know, and managing side effects is a part of having a medicine that works and yet doesn't destroy the host. So there are various results. The number one problem with a lot of the medicines that are common now, like statins and other blood pressure medicines and things that are fairly common, is dry mouth. And dry mouth is not just a water problem. Okay. Mm-hmm. It turns out that the system that lubricates the mouth has a lot of oils in it, has calcium, it has antibodies, and it has moisture. And without those things, you have a lot of negative effects on the teeth.
Mm-hmm. Mm-hmm. Well, you mentioned that your practice is mostly people between the ages of 50 and 80, so that's going to include the baby boomers. What kind of challenges are there for baby boomers besides maybe the outmoded, obsolete dentistry? What about challenges with personal care and other related health issues?
Well, that's a great point, because it doesn't get easier. People that had their mouth restored with traditional dentistry, and when I was practicing in the 80s and 90s, we believed that we were state of the art. But it turns out that the edges of bridge work and fillings get exposed as we get older, and our gums recede with just general, the general decline of our skeleton.
So there's more to take care of.
There's more to take care of. There's more angles. There's more spaces. Mm-hmm. And and even the dental work that used to fit right to the gum line, now there's a space between the dental work and the gum line, and that's extra work for the patient to take care of.
Mm-hmm. Okay, well, we'll come back to that, and I'd like to talk more about how the teeth are related to the whole body health. Okay, we'll be back shortly, and we'll be talking more with Dr. James Butler.